Hello, I'm Dr. Mabry and welcome to Botox Fillers 101. This is going to be an introductory video about Botox and fillers, and we're going to answer some of the basic questions, like where do they go, how do they work, what are some of the possible side effects, and how can you get started. Let's start with what is the difference between Botox and fillers. So you can really think of Botox as being an anti-wrinkle treatment, and Botox decreases wrinkles by decreasing motion. So for frown lines between the eyebrows, or frown lines along the forehead, or crow's feet, anything that happens with motion, Botox works by relaxing the muscles and stopping wrinkles for about 3 months. Fillers, on the other hand, are for correction and contouring of the face. And what do I mean by that? Well, they can be used to correct dark circles and bags under the eyes. They can correct a loss of cheek volume and address the smile lines. They can be used for correction of the lower face, causing jowling and loss of lip volume. And with correcting these areas, we're able to make the face look fresher, healthier, and better. Fillers are also amazing at contouring the face. You can use them to strengthen your chin. You can use them to highlight the cheekbones. And you can use them to improve the appearance of your nose. And what are fillers? Well, fillers are an injectable substance that are used to shape and sculpt the face from the inside. The first filler in the 1980s was collagen, which was harvested from cows, and this was basically used to inject fine line wrinkles and lip augmentation. Currently, most fillers are developed from hyaluronic acid, which is a jelly-like substance that's normally found in the body. It's found in the eyes, the joints, and the skin. It absorbs water like a sponge and acts as a lubricant and a shock absorber. So now that we know what fillers do, which filler is the best for you? Well, it really depends on the area of the face that we're treating. In my office, if we're working with dark circles under the eyes, or the lips, or performing a non-surgical rhinoplasty, then restylane is the best filler. What is restylane? Well, restylane is one of the original fillers. It's been around almost 20 years. It's a clear gel and it has the consistency of jelly. So it's firm, but it's moldable and you're able to spread it and make it flat. And that's really helpful in areas like under the eyes, the lips, or the nose. And another great thing about restylane is that it's reversible. Juvederm voluma is also a hyaluronic acid. This one was developed in 2005. It's a clear gel with a spongy, bouncy feel, much like tofu. And this gives it a superior lift for mid-face, cheekbones, chin, and jowling. And it lasts 2 years, and it's also completely reversible. I wanted to clarify the difference between Juvederm and Juvederm voluma. Juvederm was an earlier filler, and it's a soft product with a very gooey consistency. And it's not appropriate for facial sculpting, and it's not great for under-eye treatments. It is like Restylane and Juvederm voluma reversible. Here's an example of a patient where I had used Juvederm for under-eye treatments and for lip augmentation. And you can see while she did get a good result, she had some lines that developed under the eyes. Because of the gooey characteristics of Juvederm, it tends to sometimes cause bagginess under the eyes. Radiesse is a different filler, and this is not a hyaluronic acid. This is developed from calcium hydroxyapatite, or you can think of it as like particles that are found in the bone and teeth. And this is a white paste-like product that has a peanut butter consistency, so you can spread it flat. And this was a great filler for the cheeks and chin. You would not use this filler under the eyes or in the lips. It lasts for about 12 to 15 months. This filler is not irreversible, meaning it will eventually dissolve, but you have to wait for it to dissolve. And what are the advantages of being able to reverse a filler? This ability to reverse fillers is a powerful tool. This basically allows you to modify your results at any time, be it days or years after treatment. And this gives the patient and the injector more options and more control over the treatments. And being a conservative surgeon, I really like to have that ability. And we reverse the fillers with something called hyalumix. And this is a liquid that you can inject into the filler, and it dissolves it, turns it into water, and the body absorbs it immediately. And now that we've talked about hyaluronic acid fillers, which are reversible, I wanted to briefly talk about some of the non-reversible fillers. Sculpture and Radiesse are two fillers that last for 1.5 to 2 years, so they're temporary, but you're unable to reverse them and you have to wait for them to dissolve. Fat and Artefill, these are fillers that are non-reversible, but they're also permanent, meaning once you have them in, you're going to have those results for the rest of your life. Let's talk about how safe are the fillers. What are some of the possible side effects? Well, bruising happens about 30% of the time, in particular if you're injecting under the eyes. Lumpiness is a concern that patients may have. Both of these side effects are decreased using the micro cannula, which I use in my office. What we will see is swelling for 2 to 4 days. Now, people are concerned about having an artificial look or not looking like themselves, and you can avoid this when you're selecting your injector. In our office, we really pride ourselves on getting natural results that still look like the patient, but just a better version of themselves. Let's talk about one of the more serious risks, and this is the risk of vascular injury. This would happen if, while injecting fillers, you inject it into an artery, or if there is too much pressure around an artery, and this can cause injury to the skin, and very rarely this has been known to cause injury to vision. Vascular injury is a very rare occurrence, but there are some things you can do to make it even more rare in your office. Having a great knowledge of anatomy is important. Careful technique while injecting, and using the micro cannula really reduces the risk of having vascular injury. And that's because the tip of the micro cannula is not sharp and tends to stay out of vessels. I think this is another good reason to use reversible fillers. I do want to say that there are some areas that are technically more challenging, like the tear trough area or the non-surgical rhinoplasty. And it's important to be careful when you're choosing an injector. So in summary, fillers are used to shape the face. The different fillers differ in consistency and thickness, and this decides which filler you may use in different parts of the face. Some fillers like restylane and juvederm voluma may be reversed with something called hyalumix, and the results in general are 6 to 24 months. I hope the video was helpful, and stay beautiful.